So the other day Aditya was asking about coffee in migraine. So I looked up the literature. So it says that increased intake of coffee increases the chances of attack. But there is also a twist that during acute attack, cup of coffee relieves the attack because it causes vasoconstriction of the cranial vessels. Alright. So it better to leave the role of coffee. It's complicated. So it's a repeat class, drug promotional literature. So what is the drug promotional literature? রাশি বল কি বলছিস জোরে বল কি এরকম কি বল drug promotional literature comes in one of the table এখানে বস তো আর সব বন্ধুরা গেছে কোথায় হ্যাঁ আচ্ছা আর কেউ আসবে না তাই তো বাহ বান্টি একা হ্যাঁ বস ওখানে বস হ্যাঁ আর কবে আসবে so what is pharmaceutical promotion? Informational or persuasive activity undertaken by pharmaceutical companies and distributors, the effect of which is to induce prescription, sales and consumption of medicinal product. So the pharmaceutical industry is dependent upon the doctors for their sale. The doctor will prescribe the medicine and the sale will occur. So in order to increase their sale, they take up certain promotional activity, and one of them is drug promotional literature. So most medicine are not advertised to the patient directly. Some are. There are some like Saridon, alright, or some Gelusil. These type of medicines are advertised directly to the patient, but most medicines require prescription by the doctors. So the promotional activity is directed towards the doctor. So what is the objective of any company? Is to make profit. So the objective is to promote medicine among the practitioners so that generate more sales. So there are certain good points and certain bad points. Good points are that you come to know about the recent rules and regulation regarding anything, regarding a medicine or regarding some guidelines, alright. So you can get it. How much dose, how much dose is required, how much duration it has to be given, what are the ADRs. So you can get these recent updates, alright. And the drawback is these activities are induced by the urge for generation of profit. So there may be some concealed data or something that may not be revealed to you, alright. So you have to be careful as a physician to make sure that whatever promotional literature you are getting is up to the mark. It must contain certain information so that it will be better for you to treat the patient and better for the patient also. Alright. রোগী মরলে কে মার খাবে? হ্যাঁ? ডক্টর। ঠিক আছে? So what information are or should be present in drug promotional literature? First, name of the active ingredient. By name, What type of names are present? Brand name, then generic name, chemical name. Alright, so proper nomenclature must be present for the drug. So international non-proprietary name, approved generic name, and the brand name. Of course, it is being promoted by some company, so that will have their own brand. Then dosage form, concentration, amount per unit. So dosage form, what do you mean by dosage form? Imdad? Huh? Deepjita. Dosage form mane ki? Anyone? Syrup, capsule, tablet, or suppository. Okay. ঠিক আছে? Concentration, amount per unit. So for syrup, there will be concentration 5 gram per ml, something like that. Or amount per unit, each tablet contains 500 mg or 40 mg, 10 mg, whatever that be. Alright. Excipients. What are excipients? Anyone? Excipients? So other than the active pharmacological ingredient, there are certain substances present in the formularies. There may be dissolution agent, coloring agent, flavoring agent, alright, binding agents. These are and along with this, something must be present to increase the weight. So let's say tablet contains 1 gram or 5 gram. Have you seen 1 gram? How much 1 gram is? Very negligible. So to present it in a capsule or in a syrup form, some other chemicals, inert chemicals are used. That is the excipient. So why are excipient important? Well, the second class hochhe. So certain excipient can lead to some unwanted reaction. Alright. Mostly these excipients are inert. But that must be known to the practitioner. Acha. Approved indications. What do you mean by indication? Well, Dival. Indication mane ki? So in which disease the medicine has to be used. That is the approved indication. Approval ke the who gives the approval? CDSCO. ICMR, CDSCO. These are the approval giving organization. It must be approved for any country. Suppose in India, he is saying CDSCO, ICMR, they are giving approval. For in US, there is another body. For UK, there is another body. For Europe, there is another body. So these are different bodies that give approval. So approval is a must. If a drug is not approved in a country, you can't promote or sell a drug in a country. Alright. Dosing regimen. By dosing regimen, routes, dose per day, route, suppose oral route or IM route or IV route, per rectal route, inhalational route, whatever the route may be. Dose per day, the number of times it should be taken, thrice daily or twice daily, once daily. Alright. Number of days. Let's say for an peptic ulcer disease. Alright. 6 weeks or 8 weeks. Alright. Whatever may be the number of days, it has to be mentioned. Timing of dose. Timing of dose is important. Why it is important? Say a PPI is being given. PPI is given before breakfast in the empty stomach. Relationship with meal. So certain drugs are absorbed more in empty stomach. Certain substance inhibit absorption of drug. Example. What? What? Milk and tetracycline. Alright. Using special population. So special population, by special population means renal failure, hepatic failure, pregnancy, children, geriatric age group, these are all special population. Why is pregnancy important? Teratogenicity. ঠিক আছে? So pediatric age group, you have to calculate the dose. Not all medicines can be used in pediatric age group. What is the problem with pediatric age group? Well, I think class হয়েছিল সবে তো মাথা নিলে পরীক্ষার সময় কি মাথা নাড়বি তাহলে নম্বরটা আসবে কোথা থেকে এনিওয়ান so blood brain barrier is poorly developed, the renal system is not functional up to that of adult, liver system is not functional. Alright, so pediatric age group, it is important. Renal failure, why is renal failure important? For Aditya bol. So kidney helps in drug elimination. Alright, so you have to change the dose if there is renal failure. And certain drugs are nephrotoxic drug. You can't use it in case of renal failure. Example, give one example of nephrotoxic drug. মাথা নাড়লে কি করে হবে পরীক্ষার সময় কি মাথা নাড়বি so aminoglycosides are nephrotoxic drug. Alright, so you must be careful giving in renal failure, liver failure, the same thing. Liver কি হয় মান্টি anyone metabolism, detoxification. ঠিক আছে, potential ADR and their frequency. So why is ADR important? There may be certain life-threatening ADR. Example, the penicillin causes hypersensitivity in sensitized individual. শুনেছিস? So, and their frequency. Frequency means occurrence in a population. Say 5% in 5% population or 10% population, whatever. So in case the frequency is more, you should be carefully giving it to a population. Alright, and in case there is some ADR, suppose hypersensitivity, there must be proper remedy for that problem. Suppose the penicillin is causing hypersensitivity. So what remedy is there? কি করে hypersensitivity হলে কি দেয় anyone antihistaminic কাজ করবে in acute condition এই কি দেয় ইন্দা তোকেই বলছি আর কবে কি করবি so adrenaline is being given for hypersensitivity. Finishing only. As a interaction with other drug, food and alcohol. So patient may be having some other drug, may be taking some other drug. So that must be avoided. Drug interaction. Food. Okay. দেরি হয়ে গেছে তোকে কোনদিন দেখেছি আগে এসছিস আয় তোর নাম কি অংশুমান ওই ওর পাশে বস so there may be drug interaction, there may be drug food interaction, there may be drug alcohol interaction. Example for drug alcohol interaction, alcohol and disulfiram. Drug food interaction, এই তো এইমাত্র একটু আগে বললাম milk and tetracycline. Alright, and anything else? There is something known as grapefruit. Heard the term? Batabi lebu. So grapefruit is an inducer of enzyme that will lead to faster metabolism of certain drug that may lead to drug failure, therapeutic failure. ঠিক আছে? Special precaution, contraindication. So every drug has some contraindication. You must be careful about the legal category. Legal category, that means what is OCT drug? Over the counter drug. So that can be sold without any prescription. ঠিক আছে? Whether the drug is an OCT drug or a Schedule H drug, whatever the drug may be that required prescription, that must be there. Then cost. So you must be careful about giving it to a patient of say a patient is of lower socioeconomic status. So in that case you must not prescribe a very expensive drug. You must prescribe drug as per his affordability. Alright, so the cost must be there in the drug promotional literature. Reference to some scientific literature, maybe journals, it may be some guidelines, it may be some trials, alright, that must be there. So scientific literature, reference to scientific literature, studies, data, graphical representation, all will be there. So the reference must be there. If some drug is claiming that it is 90% efficacious, so that must be supported by some reference. So level of evidence, ঠিক আছে, primary, secondary, tertiary, ঠিক আছে, so you can classify it accordingly. Then name, address, license of manufacturer and distributor. So the license of the manufacturer that is being known, that must be mentioned in the drug promotional literature. So if question comes, what are the essential information present in drug promotional literature? কটা পয়েন্ট আছে? 14টা তো? These 14 points must be present. ঠিক আছে? আচ্ছা, so in the examination criticism of prescription was there, ছিল তো? আর কেউ ঠিকঠাক লেখেনি, I don't know why. So let's repeat it once again. এই 14টা পয়েন্ট যেন থাকে, তাহলে নম্বর পাওয়া যাবে না। আচ্ছা, in prescription criticism, a prescription is being given, so there will be not all prescription, but what the prescription that will be given in the examination, something wrong will be given. You have to criticize the prescription. Alright, now there will be some abnormalities in the format of the prescription and some abnormalities in the content of the prescription. By format মানে কি? Parts of prescription, তারপর superscription, inscription, subscription. Alright, so there will be something which may be absent or which may be missing in the format, and there will be something wrong or contraindicated will be there in the drugs written in the prescription. Alright, so you must criticize the prescription accordingly. তো পরীক্ষার সময় যেটা দেখলাম সবাই প্রেসক্রিপশনটা আবার করে লিখছে, there is no requirement of writing the prescription again. Just simply point out that this is wrong and you give a remedy. What can be done to correct that thing? Alright, don't write the prescription once again. বোঝা গেল? তাহলে parts of prescription, as Vidipta has rightly said, so it is written in a printed stationery. There will be doctor's details, patient particular, superscription, body or inscription, subscription, direction to the patient, and most importantly, signature. Without signature, a prescription has no meaning. Alright, whenever signature is being given, the prescription is being validated, and of course there should be a date. So criticism, there may be problem in the format, or there may be problem with things prescribed. Acha. So this is a prescription, this is a correct prescription. Alright. So a 35-year-old gentleman was diagnosed with amoebic dysentery. Write a prescription. So first, doctor's identity. So name is there, degree is there, MBBS, MD Pharmacology. Then registration number is there. Then contact number is there. Then address is there, time of visit, that is also there. ঠিক আছে? Then patient particular, name, age, sex, weight, height, address, everything is being given. We are not concerned about the chief complaints and the diagnosis. That is part of medicine. Alright, that should also be there in the prescription, but for pharmacology, you don't need to scratch your head about chief complaints and the diagnosis, and that's all that. Alright, so then what is that? R scratch. What is R scratch? Huh? Superscription. ঠিক আছে, I am asking about the parts of prescription. ঠিক আছে, R scratch, that is the superscription. Then we come to the inscription. কি আছে? Tablet metronidazole. So name of the tablet is given in block letters for legibility. Alright, and each tablet contains 400 mg. So dosage, form, and concentration per unit dose, that is being given. Dispense 15 tablet. What is this? Huh? Subscription. ঠিক আছে? Then direction to the patient. What is that called? Signatura. ঠিক আছে? Direction, 1 tablet twice daily. Route of administration, orally for 5 days. There is this signature and date. So this is a well written prescription. So with that knowledge, we are going to go for criticism. तो नामটা কি জানেন? क्या नाम है? हाँ? Sharma. So criticize the prescription. बैठ कर बोलो. हाँ? Criticize the prescription. A 45-year-old gentleman diagnosed as gastric ulcer. Write a prescription. Sharman বলবে. হ্যাঁ বল. Huh? Criticize the prescription. That will be, you have to write it down in your table. বল. Date not written. Then so in patient particular, sex is not written. Then registration number is not there. Or anything more? Height হয়ে গেল. আর anything? Address is not given. Then doctor phone number, that is not given. So Sharman has rightly told about the format, the wrong that is there in the format. ঠিক আছে? Now we come to the content. So ranitidine to be taken once daily at bedtime, omeprazole to be taken once daily before breakfast. বল কি ভুল আছে? Tablet, syrup, nothing is being mentioned. Then block letter লিখা নেই, ঠিক আছে। Then concentration is not being given. Then how many tablets that has to be given, that is not being written. Then date দেওয়ানি ও বলেছে, শারমান বলেছে। Then anything with the prescribed medicine? criticism তো চাইছি। Reaction to the patient দেখা আছে তো। সিগনেচার ও বলেছে। route of administration, okay, ও বলেছে dispense, বিদীপ্তা বলেছে। So ranitidine and omeprazole are given together. So let's learn something about the acid drug that control acid. So this is a parietal cell that secretes the HCl. All right. So what are the factors that stimulates secretion of HCl? There is this histamine acting on H2 receptor, ঠিক আছে, that stimulates secretion of HCl, and also this is the K plus H plus ATPase pump, ATPase. So this is what the final step is. So first there is M3 receptor, then there is H2 receptor. These all are stimulating the parietal cell to secrete acid via this K plus H plus ATPase. All right. So what is the mechanism of action of omeprazole? So omeprazole inhibits this pump, and mechanism of action of ranitidine. Ranitidine. Anyone? অংশুমান যেটা বলছে, that is correct. It acts on H2 receptor. All right. So it is an antihistaminic. It acts on anti-H2 receptor, blocks H2 receptor. So if I am blocking this K plus H plus ATPase, will there be any action on the, any action is required on the H2 receptor? Nah. All right. So that's the wastage of drug. ঠিক আছে? The final common pathway is being blocked. So you don't require another H2 receptor blocker. So that is a wastage of drug. ঠিক আছে? তাহলে কি বলবো? দরকার নেই। You can give omeprazole twice or ranitidine twice if you require to control the acid. ঠিক আছে? The final pathway that can be blocked by omeprazole. So the stimulator that causes acid secretion, that may not be required to be blocked. ইমদাদ, বুঝলি? কি বুঝিস আমি? নেক্সট দিন জিজ্ঞাসা করলে আবার সেই একই। আচ্ছা, নেক্সট প্রবলেম of pregnant ladies in her second trimester visiting physician with complaints of headache. Her BP was 190 by 110 millimeter Hg. She was diagnosed as gestational hypertension. Prescribed drug, Bantibol. Patient age দেওয়া নেই, সেক্স লেখা নেই, অ্যাড্রেস, হাইট, ওয়েট লেখা নেই, আর তার উপরে কিছু ডক্টরস পার্টিকুলার তাহলে স্টেপ বাই স্টেপ যাবি, go step by step. First go to the doctor's detail if is there any problem, then come to the patient detail if there is any problem. So in doctors there is no phone number or any address or any contact, nothing is being there. ঠিক আছে, then তারপর হয়ে গেল তো, তারপরে বোল্ডে লিখে নি, ঠিক আছে, তারপর signature. So signature is not there. So this is an incomplete prescription. ঠিক আছে? So that is about the format. ঠিক আছে? Now we come to the content. তাহলে tablet telmisartan. Can tablet telmisartan given in pregnancy? If no, why? Amrita. হয়ে গেছে না, কার্ডিওলজি হয়ে গেছে না? So telmisartan is a teratogenic drug. It causes agenesis of kidney in the fetus. ঠিক আছে? So that cannot be given in pregnancy. ঠিক আছে? So suggest a remedy, labetalol. ঠিক আছে? আচ্ছা, 1 tablet OD. So you should avoid short forms. ঠিক আছে? Write once daily. Next problem. A 11-year-old boy with history of thalassemia and repeated blood transfusion presented in OPD with complaints of weakness. His hemoglobin is 5.7 gram per dl. Prescribed drug. So this is a thalassemic patient. বল দীপজিতা বল। এক এক করে বল, ওপর থেকে আয়। ডক্টরস ডিটেল, ঠিক আছে, তারপর জেন্ডার নেই, কিছুই নেই, এজ সেক্স কিচ্ছু নেই, তারপর দেন so no formulation is being mentioned. Then how many tablets to be dispensed, that is not being mentioned. Okay, that is about the format. ঠিক আছে, well, what is wrong about the drug prescribed? So what is the pathology of thalassemia? So the problem is not with absence of iron. A problem with thalassemia is, well, problem of thalassemia ki? So what he is telling, the problem of thalassemia is with synthesis of proteins chains. Alright, so alpha chain may be absent, beta chain may be absent. In fact, thalassemia patient have excess of iron in their body because they receive repeated transfusion. Okay? So that iron get accumulated in the body, but that iron cannot be utilized by the patient. That is the problem with thalassemia. So already there is iron overload and you are complicating it with more and more of iron. Okay? So what's the remedy? Sharman wall. What's the remedy? Aditya, what's the remedy? Signature bolchi na. What is the remedy? Iron is dichchis. What is the remedy? Bone marrow transplant. Bone marrow transplant is the ultimate solution. So what do you do now? His hemoglobin is 5.7. Blood দিতে হবে, ঠিক আছে, you simply transfuse blood. That is the immediate solution. Alright, বুঝলি? মন খারাপ কেন? তাহলে 50-year-old diabetic patient complains of episode of chest pain. He is diagnosed as angina pectoris. Prescribed drug. Well, criticize this prescription. Registration number নেই, then address নেই, address তো দেওয়া আছে, SMC বোলপুর, পেশেন্টের ওয়েট ঠিক আছে, then so what is being prescribed? Tablet Inderal. So this is a brand name, ঠিক আছে, it's a brand name of propranolol, and you should avoid giving brand name, write in generic name, ঠিক আছে. So tablet Inderal 10 mg, that is there, formulation is there, concentration per tablet that is also there. Then direction, one tablet taken TDS, so there is abbreviation, you should avoid abbreviation, write thrice daily. Then injection human actapid. Now human actapid is another brand name for regular insulin. Alright, so 7 units TDS, 7 there is TDS is being there, so write thrice daily before meal to continue. So what is this problem with propranolol and insulin being given together? Beta blocker is contraindicated in, no, not in diabetes, in with hypoglycemic drug. So what is the most common adverse effect of insulin? Hypoglycemia, ঠিক আছে. What happens if there is hypoglycemia in the body? What changes, physiological changes will it show? Sweating, then tremor, then palpitation, ঠিক আছে. Now all these signs and symptoms are due to adrenaline, alright, acting on the beta blocker. So what is the remedy if there is palpitation, tremor, sweating? মিষ্টি খেয়ে নেবে, ঠিক আছে. If the patient is conscious, he or she should take oral glucose, গ্লুকন-ডি খেতে পারে, কিংবা চিনি খেতে পারে, লজেন্স খেতে পারে, রসগোল্লা খেতে পারে, anything sweet that increases the blood glucose level, that is the remedy whenever there is an attack of hypoglycemia. Now what happens if there is a beta blocker in the system? All the, as Ashi has said, all the signs and symptoms will get masked. There is palpitation, tremor, sweating, everything will be masked. So patient cannot identify that he is having hypoglycemia. Alright, so beta blockers are contraindicated with insulin or other hypoglycemic drug. There are certain safe drugs. So what is the remedy? Either change beta blocker, ঠিক আছে, better to change beta blocker. There are other anti-anginal drug, calcium channel blocker. এই angina হয়েছে? angina হয়েছে? কেউ জানেই না. 30-year-old lady diagnosed as 5X malaria. Prescription. অদ্রিজা বলবে. Start from the top. doctor's degree is not present, then patient address নেই, doctor has no phone number, ঠিক আছে, then superscription is absent, R scratch is absent, then বল বিদীপ্তা বলবে, হ্যাঁ ট্যাব লেখা আছে, সো ইন ব্লকে হয়, ঠিক আছে, ট্যাব শর্ট ফর্মে লেখা আছে, concentration per tablet is not, PCM means short form paracetamol, ঠিক আছে, so that is the problem with the format, ঠিক আছে. Now we come to what is the problem with the content. So what is radical cure? Aditya, radical cure. Have you a life cycle of malaria? Have you life cycle of malaria been taught? Huh? Well, life cycle. So life cycle of malaria. So malaria is transmitted by female Anopheles mosquito. Alright. Once the female Anopheles mosquito releases the vector in the blood, it goes to the liver, where it transforms into hypnozoids. From hypnozoids, merozoids enter into the reticulocyte, and then there is tropozoids. Alright. Now these hypnozoids may remain in liver for a prolonged period of time, dormant in the liver. Then after a prolonged period of time, they may awake. So there may be relapse. So there must be something given to kill the hypnozoids. So that is the radical cure. সমূলে বিনাশ, ঠিক আছে. So what has to be given? So primaquine is usually given to kill, so for the radical cure, ঠিক আছে. So this prescription is incomplete, ঠিক আছে. Primaquine must be given. And next problem, a 25-year-old gentleman with multiple fungal lesion in anterior thoracic wall and right upper limb came to the OPD, prescribed medicine, Atibol, then date is missing, ঠিক আছে. Anything more? বিদীপ্তা কিছু বলতে চাইছে. FTU is fingertip unit. What is it? Fingertip unit, 5 millimeter diameter of tube from the distal interpharyngeal joint up to the tip of the finger. The amount of ointment that can be taken, that is fingertip unit, ঠিক আছে. So what কি জানো তোর নামটা, অদ্রিজ না কি জানো নেম, Sakshi. What Sakshi has told is somewhat correct. So what is the problem with the content? The problem with the content key, anyone? So there is a mycology পড়ানো হয়নি এতে, মাইক্রোবায়োলজিতে ফাঙ্গাস পড়ানো হয়েছে? আচ্ছা, so you see there are multiple fungal lesion. Alright, if there was a single patch, it would have been effective by a ointment. So there are multiple fungal lesion. In such case, you need some oral antifungal drug. Alright, either itraconazole, fluconazole, whatever be it, need some oral antifungal drug. বোঝা গেল? এরকম ভাবে পুরো প্রেসক্রিপশন লেখার কোনো প্রয়োজন নেই, ঠিক আছে, প্রচুর লোক লিখেছে, I don't know why they have written it. So you just need to point out what is wrong with this prescription, the format, something wrong will be there in the content, just point out what is wrong and prescribe some remedy, that this must be there. Any questions?